AI is changing the fight against cancer. I'm Sarah from Remission Support, and in this video, I'm going to be sharing some really exciting news on how artificial intelligence is revolutionizing cancer treatment in ways we never thought possible. For one, it has the ability to diagnose cancer with up to 95% accuracy and can cut the diagnosis time in half. How great is that? And it gets better. Studies are now showing that AI can also improve cancer treatment outcomes by 50%. Even though AI technology can't cure cancer itself, it's helping doctors and researchers save more lives than ever before. So how does it do this? So most of the superpowers from AI come from its ability to learn huge sets of data, and it then uses that information to analyze and predict trends very quickly. So in oncology, it can be used to analyze patient diagnostic images or genetic information and predict how they'll respond to certain cancer treatments and how effective a treatment like, say, chemotherapy will be at killing their unique cancer cells. Amazing, right? Even though AI is relatively new, the technology we already have is giving oncologists and cancer patients newfound hope. Until now, detecting cancer would sometimes take weeks, even months, depending on where you live in the world. And radiologists train for years on how to spot cancer in patient images, but obviously there's always a chance for human error when images are read by a doctor. But with AI and its incredible ability to spot trends in data, it's proving to be an incredible tool for radiologists, allowing them to detect cancer in images faster and with more accuracy, meaning patients get diagnosed faster. And as I'm sure you're aware, this is really important because the sooner you diagnose cancer, the better. The more effective your treatments will be, and the greater your chances are at being cured. AI algorithms can analyze CT scans, MRI scans, and X-rays to detect early signs of cancer that can easily be missed by human eyes. For example, MIT developed an AI model called Sybil that can predict a patient's risk of getting lung cancer up to 6 years in advance by analyzing a low-dose CT scan. Also, Google's AI system has shown to be able to predict breast cancer in mammograms much more accurately than radiologists can, significantly reducing the risk of false negative and false positive results. But it's not only diagnostic images that AI is helping with, it's also speeding up the analysis of tissue biopsies. So you may be wondering, well, if that's the case, will AI replace radiologists or doctors? No, well, at least not anytime soon. Doctors are still needed to interpret AI results and make important treatment decisions like whether a patient will have chemo or radiation therapy. Plus, they're needed to provide emotional support for patients. So AI tools are here to empower doctors, not replace them. Now let's talk about how AI is transforming cancer treatment because this is really impressive. AI is paving the way for a new type of cancer treatment called precision oncology. This new type of treatment involves studying a patient's cancer cells and creating a personalized treatment that will target their genetic mutations that are driving their cancer to grow. And the greatest thing about this treatment is that it's more effective and less harmful than traditional treatments like chemo or radiation therapy. I explain precision oncology and personalized treatments more in my video titled Exciting Advancements in Cancer Treatment, so I'll link that below for you to watch next in case you're interested. But a great example of this is an AI company called Tempus, which is able to analyze the genetic information from a cancer patient, and it creates a personalized treatment care plan for them by selecting specific chemotherapy or immunotherapy drugs that it knows will be most effective at killing their cancer cells. And this is truly amazing because it improves the treatment outcome for the patient and can significantly increase their chances of survival. Now, a third way that AI is helping us beat cancer, which I think is really cool, is by predicting your cancer risk. AI systems can be trained to analyze massive sets of patient medical histories, genetic information, lifestyle factors, and other relevant data, and they can use it to predict your risk of getting cancer or having it come back. For example, for a breast cancer patient who's had a lumpectomy, AI can be used to predict the likeliness of tumor recurrence after surgery. So this can help patients to make certain treatment decisions like whether they want to continue on with hormone therapy, or if they want to make changes to their diet or lifestyle, or monitor themselves more closely with more frequent diagnostic tests for early detection and intervention. And for people who are going through cancer treatment, these tools can also be used to predict the progression of their disease by examining DNA mutations and specific markers associated with their type of cancer. So basically, this helps doctors predict how a patient's cancer cells will respond to a certain type of treatment so that they can tailor their treatment plan and use the most effective strategies with the least amount of side effects. So these amazing AI tools are already being used in some countries, and they're reducing the amount of time it takes for patients to start treatment after they've been diagnosed. And then once treatments begin, AI also supports real-time monitoring of their progress. It can continuously analyze their symptoms, imaging scans, and blood results to detect subtle changes that may signal a shift in how their cancer is progressing or how they're responding to treatment. For example, if a patient's cancer cells are showing resistance to a certain drug they're taking, their oncologist can immediately switch them to a different drug before their cancer progresses. So this brings us to the fourth way that AI is revolutionizing cancer treatment, and that's with new drug development. Until now, the whole process of discovering and testing new drugs for cancer treatment has been very slow and very expensive, often taking years to bring a new drug from the lab to the clinic. But now AI is dramatically speeding up the development of new drugs in every stage of the process, from identifying potential drugs to optimizing clinical trials. Because AI tools can sift through massive databases of genetic information from cancer patients, researchers can develop drugs that specifically target and inhibit the activity of these mutated genes a lot faster now. AI can also help researchers find the most suitable patients for trials, ensuring the new drugs are tested on patients that can benefit from them the most. Pretty cool, right? Not only that, AI can also analyze real-time data from trials and predict how each patient will respond to the new drug, monitor their side effects, and then recommend how their dosage should be adjusted accordingly. So obviously the impact of AI in developing new cancer drugs is being felt across the pharmaceutical industry, but it's also being used on existing chemo and immunotherapy drugs to repurpose them so that they're able to treat more types of cancer. So despite all the great things I've been talking about in this video, obviously there is one downside to all of this. Since these AI tools are relatively new, unfortunately they're not yet accessible for all cancer patients. It's largely based on where you live or the type of medical facilities you have access to. Obviously these new technologies are more accessible in developed countries with more advanced healthcare systems like the US or the UK or other high-income countries where AI is already integrated into their overall healthcare system. But unfortunately it may still be a while before low to middle income countries have access to these AI tools because they do come with a high cost of development and implementation. However, there are some funding initiatives happening from both government and non-government organizations, as well as partnerships with a few of the big tech companies. So this will help to mitigate the cost for smaller countries to implement AI tools so that more people around the world can have access to them. It's no secret that AI is everywhere. And this can be kind of scary, right? Because it has the potential to change every aspect of our lives. I mean, gone are the days of reading old magazines in waiting rooms. With AI, your next doctor's appointment could be a virtual consult with a friendly robot. Although we do still need doctors to make final treatment decisions, as I mentioned earlier, AI is helping to solve the staffing shortage of doctors and alleviate some of their workload, but it's also reducing the wait time for patients and helping people who live in remote areas have better and faster access to care. And this is really just the beginning. Imagine getting a text message on your phone saying, "Hey, I noticed your smartwatch detected an irregular heartbeat. No worries, I already booked you a slot for a virtual checkup tomorrow." But when it comes to cancer, I think it's truly amazing that AI is already helping doctors identify cancer with impressive accuracy, even in the earliest of stages, leading to earlier diagnosis. And since no two people are identical and their cancers are also unique, it makes sense that cancer treatments are becoming more personalized. And we haven't been able to do this before, but with AI, we can finally analyze a person's genetic makeup, medical history, and unique tumor characteristics, which is allowing doctors to tailor their treatment plan with laser focus, maximizing their effectiveness and minimizing side effects. So the future of cancer treatment is one where we can catch it earlier, have personalized treatments for maximum effectiveness, and new drugs at our disposal at an unprecedented pace. Unfortunately, the fight against cancer isn't over, but with AI by our side, we're closer than ever to a world where cancer is more curable. I'm linking a similar video for you to watch next on more exciting breakthroughs in cancer treatment. And as always, if you're finding my videos helpful, please consider subscribing to the channel so that the YouTube algorithm will share the videos with more people who can benefit from them as well. Take care, and I'll see you next time.